It is happening by sectors. In the health sector, of course, the private sector has to be brought in. There is going to be increased government and private sector participation to provide adequate medical services. So this is one step of which the government is aware, and this is going to happen. Other one, and therefore the overall health spend in the country has to increase because, as other people said, the expectation of people for a good quality health service is increasing, and they would demand that.
Rising expectations, Leela Jacinto.
Rising expectations, but what is very characteristic of what we have seen now is how the policy was so directed at the middle class. The lockdown was imposed in a way that the middle classes could manage it with no foresight into how the vast majority of India's population will live. You will see also, I predict, in the weeks and months to come, some sort of health diplomacy. India has a vast pharmaceutical industry. China is also embarking on a health diplomacy. So, we will have private sector coming up with vaccinations. But, the whole issue of distribution, of equitable distribution, I kind of agree that this will really not this will not be on the agenda. Once again, the middle classes, the growing economy will take the center stage, and the basic problem, which is India's vast population, which has not been served, will be overlooked. And another thing is also, the social fabric. And actually, Siddharth Bhate would be far, in a better state to address this. But it's also the narrative. How much of the narrative of the failures can be covered by the press? How much can be discussed without, the media getting facing facing defamation lawsuits or criminal lawsuits, So what is the freedom that this pandemic is can we address this?
All right, let me put it to Siddharth, and this will be the final question. Siddharth, has there been censorship or self-censorship when it comes to coverage of this pandemic?
No, in fact, I would say there's no censorship at all, nothing formal anyway. And self-censorship, if at all it is there, it is at the level of managements and editors rather than journalists. But I can tell you that there is no need for self-censorship. There is no need for pressure because vast amounts of influential media platforms, print and television, have so happily joined the Rara Brigade, and they've done it by simply doing one thing, by simply ignoring the real issues. I mean, there's hardly any serious COVID coverage now, hardly. And they're all the television channels are obsessed with some film star who has died, accidentally. All they're chasing those kind of stories. So there is no censorship, but there is no media. And there is no journalism. So where is the question? I mean, so all these debates that we are talking about are happening in a very small pool, and they are not reaching the general population. So the general population could well be lulled into thinking all is really well, and that everything has been managed extremely well. The 4 million number is not coming out on a daily basis in any kind of hard-hitting way.
All right, so
we are in a very surreal situation as far as the media is concerned in this country.